over to Rachel Chapman. Rachel is a former science teacher and current school librarian at the George Westinghouse Educational Campus in downtown Brooklyn, serving grades 6 through 12, where she loves engaging students in reading and research. Rachel received her Master's of Science in Library and Information Science from the University of Illinois Urbana-Champaign, and she brings over a decade of public education experience to us today, having been a Brooklyn Connections partner teacher since 2018 and currently working with us at Brooklyn Connections as a STEM curriculum consultant. So thanks for organizing this with us today, Rachel.
Yeah, I'm so excited to be here and introduce our guest speaker, Kenneth C. Davis. Ken is the New York Times best-selling author of many books, including his series on Don't Know Much About History. His book, In the Shadow of Liberty, was an American Library Association notable book and YALSA finalist. And his books, More Deadly Than War, which we will talk about today, as well as his newest book, Strong Man, The Rise of Five Dictators and the Fall of Democracy, have been popular with young people in my library, at least. Ken has been a frequent guest on national TV and radio programs, and he enjoys virtual visits with middle and high school students, which we'll discuss later, to talk about history, and he lives here in New York City.
Hi, Rachel. Thank you so much, and thank you all for coming. I'm going to speak very briefly about myself for a little bit, and then we're going to have a conversation. This is not a lecture, it is a conversation, and I hope to get us to as many questions as possible. You know my name. Most people know me for this book, Don't Know Much About History, which I'm shocked and appalled to say came out 30 years ago. It doesn't even seem possible to me. It is a book of questions and answers about American history for all of those who were supposed to learn it and never did. I always loved history. I loved history from the time I was a kid. I was lucky. My parents' idea of summer vacation was to throw us in the back of the car with some old tents and sleeping bags, true World War II surplus. And we'd go to places like Gettysburg and Valley Forge and Fort Ticonderoga in upstate New York. So from a very early age, I had the sense that history isn't just something that happens in books. It happens to real people in real places. And that's what I've tried to bring, the sense that I've tried to bring to my writing. And that's especially true of these recent books, the ones you've singled out, which are aimed at young adults, but I find older adults like them just as much. The stories in the Shadow of Liberty are about 5 people enslaved by presidents. The stories in Strong Men are about the men who became the most ruthless dictators in history and brought democracy down. And of course, the subject at hand, the most deadly pandemic in American history to date, 102 years ago. These are essentially human stories, and we can learn a lot from them. And that's the real reason I've been writing about history. It's not dates and battles and speeches. It's really about what we can learn about the past, bringing us to where we are, and what we should and could learn from the past to do a little bit better. I will just also briefly add before we get started that I grew up just outside of New York in Mount Vernon, New York. And I was a very, very serious reader as a child, but we didn't have any bookstores, but we had a great public library. And I am a child of the library. So I'm so pleased to be joining the Brooklyn Library today for this presentation. So thank you for having me.
Yeah, thanks for being here. And I see my other boss in the chat, Melissa Jacobs, sharing that these books are available for New York City Department of Education students and staff on our ebook platform, Sora, as well as on the public library ebook platform, Libby. So I wanted to share with the audience that the the Q&A is open. If you have any questions, please feel free to put them in at any time, and we will try to get to as many as possible. I would love to start us off with a few questions. Maybe you could share a little bit more about your book, More Deadly Than War, and maybe in the lens of how we could use the history of the Spanish flu to inform our understanding of, I mean, there's been so many other pandemics and epidemics since then, as well as modern medicine and what we're going through today.
Right, absolutely, of course. For those who are completely in the dark, and I don't think anyone is in the dark about the 1918 influenza pandemic any longer. 2 years ago when I wrote the book, it was still a bit of a mystery to a lot of people, but we've all learned a lot more since then. The Spanish flu, as it was known then, and we'll discuss the name because there's even some controversy to that today. The Spanish flu began in the the spring of 1918. It began largely on American army bases as the United States was getting ready to enter World War I. World War I, of course, it started in August of 1914. The United States did not become involved until declaring war in April of 1917. And because we had no army to speak of, it took almost a year for the United States to be really prepared to send men to Europe. But they were training hundreds of thousands, eventually millions of young men in army bases spread all around the country. And it was in those bases that the influenza of 1918 started to spread, crowded into barracks together. Then they got onto trains, crowded together on trains, and then onto ships. 1 million young American servicemen, doughboys as they were known, landed in Brest, France by May of 1918, and the influenza spread across Europe. It would eventually kill more than 675,000 Americans in a little more than a year's time. Just for some perspective, that's more than the number of Americans who died fighting in World War I, World War II, Korea, and Vietnam combined. It's also about equivalent to the number of people who have died from HIV and AIDS over 30 years. So this was an extraordinary impact on the United States at the time. What's remarkable, and one of the reasons I wrote the book and called it The Hidden History of the Spanish Flu, is that it was really written out of the history books. In spite of the fact that it was the most deadly epidemic in American history, most people had never heard of it until fairly recently. The fact that it came during the war had everything to do with its spread as a global pandemic, and it truly did become a global pandemic. Perhaps 50, maybe even many as 100 million people around the world died of influenza in a little more than a year's time. It had an enormous effect on the war itself. The war had an impact on the spread of the influenza, and it would have long-reaching effects afterwards, both in American society and in history. So it's a really important moment in history, and more to the point, we should have learned some very important lessons from it. And I'll just briefly talk about those, and we can come back to it. To me, the three most important lessons from the 1918 influenza is that lies and censorship and propaganda are deadly. That was certainly the case then, where the news of an epidemic was really kept out of the newspapers deliberately in some cases. The second point is equally important to today: misplaced priorities. In 1918, the president's priorities at the time, and that's Woodrow Wilson, was the war. That's all America was concerned about, was getting ready to get troops sent to Europe and keep the war effort going. That meant keep the factories going. That meant keep the Liberty Loan parades going, and we'll talk about that perhaps in a moment. And the final point is that ignoring science is lethal. In many cases, scientists, even though they did not understand what they were dealing with, they were warning politicians, generals to do things differently Those warnings went ignored, largely because they wanted to continue the war effort, and that proved to be more deadly than war. So there are very, very specific lessons that we can learn from 1918 that we should have applied to what we're going through now. Unfortunately, those lessons were largely ignored by the leadership in this country. Just the last piece of kind of science-y information about this pandemic. In 1918, they certainly knew what influenza was. That word had been around for a very long time, although it went by other names. A lot of people called it the grip. Maybe you've read that in, kind of old-fashioned books. Oh, he's got a case of the grip. They meant influenza or the flu by that. Some people called it cholera. So it went by different names. They understood what influenza was for centuries. Hippocrates writes about it 2,500 years ago, the father of Western medicine, the symptoms of what we would think of as flu. What they didn't know was what a virus was. Science understood bacteria because bacteria could be seen by a regular microscope, a traditional microscope. They'd been seen and studied for a very long time. But a virus was too small to be seen by the technology of the day. It wouldn't be seen and be able to be filtered for a long time to come. So the scientists were really fighting, the medical people were fighting an invisible enemy that they didn't really understand. And that certainly contributed to the widespread death toll from the Spanish flu. But there's no question that it was far more deadly than what we are experiencing now. And it swept through this country like a wildfire, especially in the fall of 1918. So there's so much to talk about here that compares to what we are going through, even though there are great differences between 1918 and 2020.
So we got a couple of questions that kind of relate to what you've been talking about. You said that it was largely left out of the newspaper at the time. Was life, this is Margaret B's question, was life so disrupted during the 1918 pandemic like today, with stores, restaurants, schools, theaters, sporting events closed, and did everyone wear masks?
Those are very good questions. And let me give it some, again, the perspective of the nation at war. World War I, of course, was the first large-scale war in America since the Civil War. There had been the Spanish-American War in between that was very short, relatively few numbers of troops, although had an interesting connection to disease because yellow fever during the Spanish-American War killed more men than the Spanish-American War did, more American soldiers. And it was actually during the Spanish-American War that they figured out that mosquitoes were the drivers of yellow fever, and they were able to eradicate yellow fever largely after that experience. The man who figured that out was named William Gorgas, and he was the Surgeon General of the United States during World War I, and he was really responsible for trying to figure out the Spanish flu. To the question, the immediate question, because the United States was at war, that was really the focus of the federal government. And we have to remember also the federal government did not exist in 1918 the way we know it today. There was no National Institute of Health. There was no CDC. There was no Department of Health and Human Services. There was, a very, very small federal government at the time. And most Americans had two connections to the federal government back then. You paid your taxes and you got your mail. That was basically it. You didn't have a big federal bureaucracy. Of course, most of these institutions that we know and familiar with really were the creation under Franklin D. Roosevelt during the Great Depression and World War II. So the idea of a federal government responding to this just wasn't really in the picture. President Wilson never mentioned publicly the flu once while he was president. Rather extraordinary idea, but he didn't. This was really left up to localities and to states, to the governors. sort of mirroring what has happened in the past year, but it's for very different reasons back then, obviously. So it was really up to each city, each locality, each state in some cases, to determine what was going to be closed down. And there were controversies about it, just as there are controversies today. The most interesting case, I suppose, would be to look at what happened in Philadelphia. Philadelphia, of course, was a big city with a big port and military installations nearby. They were going to have a parade to sell Liberty loans, which were war bonds. Very, very important idea. During World War I, you were expected to buy your Liberty loans. If you didn't, you were suspect. This was really more than just something casual. This was a full-scale marketing, even propaganda campaign to pay for the war. In Philadelphia, in September of 1918, they were planning a big parade with John Philip Sousa there, and they were going to have airplanes, which people had never seen before, flying overhead. 200,000 people crowded the streets of Philadelphia on September 28th for the Liberty Loan Parade. 2 days later, every hospital bed in Philadelphia was filled with flu patients. Now, the health department and the head of the health department in Philadelphia was aware that there was flu around. He was told not to allow this parade to go on, but he did because of the enormous political pressure to keep the war effort going, to keep the economy going, to keep the factories and the shipyards going. So that's specifically where I can point to this idea of misplaced priorities. Now, other cities saw what happened in Philadelphia, and they could see that the flu was moving across the country, basically from east to west, although eventually it spread over the entire country because ships were bringing it around to the port, different ports around the city. But in St. Louis and San Francisco in particular, they saw what had happened in Philadelphia in September of 1918. They shut their cities down. Philadelphia waited until it was too late, about a week after the outbreak. And it was too late, and there were tremendous losses in Philadelphia. San Francisco and St. Louis did exactly what the questioner asked. They shut down schools, churches, stores, shops, everything. San Francisco had a very, very rigid mask law. The image of 1918, it's on the cover of the book, is the gauze mask. So very different kind of masks than what we are familiar with, obviously. But San Francisco had a mask law. If you didn't obey it, you were a mask slacker, you could be fined. Levi Strauss, the jeans maker, San Francisco based, actually said that they would provide masks for everyone in San Francisco. I think they made something like 40,000 masks immediately. San Francisco had a very good experience at first, keeping their infection rate and their deaths very low. But they opened up too soon. They saw a spike, just as we've seen in recent months here. And the deaths and the infections went up. Same thing in St. Louis. Once it went up, it's much, much harder to get it back down again. And in San Francisco specifically, they wanted to enforce the mask rule again, but people said they were not having it. The same kind of resistance to masks that we hear today was true in 1918, especially in San Francisco. So a lot of parallels to the shutting down of schools and businesses and churches, and the same kind of debates that we are having today about these closures. In most places, they did not close. The places that did best were the places that closed and quarantined most effectively. So it's a really good question and a really good comparison point and parallel to what we've seen in the country today.
You mentioned that they understood bacteria but not viruses. Did they understand, this was a question, did they understand the contagiousness? Like when they had that Liberty Loan parade and then all the people were in the hospital 2 days later, did they make that connection?
Yes, they did. They absolutely understood that sneezing and coughing were still a problem. The signs around Philadelphia, and they were similar in different parts of the country, were spit spreads death. You were made not to spit. Brooklyn, in fact, had a anti-spitting law. You were fined $1 a day for spitting in Brooklyn. Just the same thing in Manhattan. In fact, I live near the Jefferson Market Library, which used to be the Jefferson Market Courthouse, and I found the records of people being taken to the Jefferson Market Courthouse for spitting on the subways and being fined $1. So yes, they understood transmission, not completely scientifically as we understood it. They didn't quite understand, I don't really believe, because they couldn't really envision how small and how enormous the problem of a virus is. That the idea, for instance, that you might cover your nose with a mask or you might cover your cough with a handkerchief, but if you put your hands to your face, and we've all stopped doing that, haven't we? We don't put our hands to our faces anymore. They didn't understand that your hands had this virus on it, and that was the source of infection. So there was minimal understanding of what the virus was, some understanding of how it spread. They certainly understood the idea of quarantine, but part of the problem was the numbers became untenable. So many people were getting sick so quickly and dying so quickly that it was difficult to keep those quarantines going. And once again, the war effort had to go on. So in the factories where they're making the tanks and the airplanes and the ships in the Brooklyn Navy Yard and the uniforms for the soldiers to wear, people were crowded together in factory settings. No sense of social distancing there. So it was really a situation that the limited science that they understood was going up against the war effort and the fact that people were really not paying too much attention to what they were supposed to do. And masking is a good example of that. In those days, you couldn't go to the drugstore and buy a nice pack of medical masks. You had to make your own for the most part. And the instructions for making your own mask, I've read them, they were pretty elaborate. It involved gauze or cheesecloth, which has a lot of holes in it. So you really had to wrap a lot of cheesecloth to make an effective mask. You were also supposed to clean it every day. How many people wanted to get involved with making a mask, cleaning it every day? So mask use was effective in some cases, but widely ineffective during 1918.
Yeah, there's actually an iconic photo that is now part of the Center for Brooklyn History of the Red Cross nurses making those rolled gauze masks. And I think you put one of the images, or a similar image, is also in the book.
Yes, that image is in the book. If it's not the same one, those are Red Cross nurses or volunteers. They may not have been nurses, but Red Cross volunteers who were at Camp Devens, which is just outside of Boston, Massachusetts, which really became ground zero for the influenza outbreak. And I should mention here, again, just the broad outlines. It came in waves in 1918. There was certainly a springtime wave, March into early June, perhaps, faded away as flu season typically does. Came back in late August and September, once again carried by troop ships going back and forth between Europe. First hit Boston. From Boston, it went to this Camp Devens, where they sent 4 doctors to try and figure out why healthy young men were getting sick and dying in extraordinary numbers. And I'll come back to the young men aspect of this in a second. So those nurses who had gone up there to prepare bandages to send to the battlefield were all of a sudden instead making masks because they knew that they had to do something about it. But this was one of the other unusual aspects of the influenza in 1918. As I said, it came back more violent, more virulent, more lethal in the second wave, which is in the fall of 1918. What the doctors were seeing was that healthy young people, first young soldiers who were reporting to camp, healthy farm boys, and falling sick, and in many cases dying, in some cases in a matter of days, sometimes in a matter of hours. They had never seen this before. Just as we know influenza tends to kill the very elderly and the very young, that was true back then too, except with 1918. It was killing young people, young adults, 20s, 30s, and 40s at an unusual rate. And the death was not pretty. I should describe. You got high fever, aches, really racking body aches. Soldiers described feeling like they'd been hit by baseball bats, very high fevers, bleeding from the ears, nose, and mouth. It's pretty graphic, but it's true. I mean, some of it gets into Walking Dead material. But they didn't understand. Oh, and this is the next aspect of it. These young men, soldiers, were turning blue. That's a medical condition called cyanosis, which means you're not getting enough oxygen into your lungs. Their lungs were filling up with fluid, and they were literally choking to death on their own body fluids. They turned blue in some cases. Before it was known as the Spanish flu popularly, it was known as the Purple Death. So it was a grim and horrible death. And the doctors who were up in Boston, outside Boston, looking at this, really were wondering if this wasn't a new plague, the bubonic plague, come back in a different form. But no, it was influenza like no one had ever seen before. And wherever it happened, you had the same description. The bodies are stacked like cordwood. It's difficult for us to understand. We saw here in New York during the worst months in April and May, the refrigerator trucks, the morgue trucks outside the hospitals, in some cases, a mass grave being dug. But this was widespread around, particularly in big cities, and particularly on army bases and army camps and naval stations around the country. Again, the connection to the war is so significant.
Yeah, there's a couple question and a comment that came up, and I thought I loved the way this was phrased from Dan. It seems as if there was something of a national amnesia in the immediate wake of the pandemic that limited what future generations of leaders could or did learn from it. What do you think accounts for that mass forgetting? And then there was also a comment that came after from Stuart, that both his father and father-in-law were in New York City in the early 1900s, and no parents, no grandparents ever mentioned it. So I wonder if you could speak to what accounts for the mass forgetting. Why do we do that?
The forgotten pandemic is what it was called in a very famous book that came out in 1976. It was forgotten. It wasn't written about. It didn't go into the history books, certainly into the histories of World War I. It wasn't even talked about much in the memoirs of some of the doctors who had been involved with the search to find a cure and a search for a vaccine. And they were desperate to find a vaccine, again, because they couldn't isolate a virus. It was impossible to come up with a vaccine. They did have vaccines that were bacterial based, and it had some effect on the pneumonia that sometimes followed the initial problem with the flu. That's very typical. You get fluid in the lungs, you get a bacterial infection. So they were seeing some effect of that, but it certainly wasn't a vaccine for this virus. Flu vaccines would not come around until the 1940s. But there was this mass forgetting. And many writers have described it as an amnesia for the whole country. The suggestion is that the massive loss of life in the United States, combined with the massive loss of more than 100,000 soldiers, and that was really in the space of a few months. We think about World War I being drawn out over a long period of time. The United States essentially was in the battle from the spring of 1918 until November 11th, 1918. a few short months, 100,000 men died, most of them in more than 100,000, most of them in this same period that the flu was raging. And a lot of those deaths are attributed to the flu as well. So it was so terrible and so tragic and so widespread that there's a belief, I think, and there's no really other way to describe it, that everybody wanted to kind of forget and move on. And you remember, of course, that 1920 became a presidential campaign year, and Warren G. Harding campaigns and wins the presidency on the idea of return to normality. People wanted to get on with their lives. They wanted to forget what had happened. They wanted to forget the war. They wanted to forget the flu. And in many respects, the country went into this period. These are the interesting kind of social ramifications of the influenza coming with the war. People wanted to move on. And so they started moving to cities. It's a marking point that changes America from primarily a rural country to a more urbanized country. People were moving to cities. Factories were opening. Jobs were opening to women. Women got rid of their clothes from the 19th century and were wearing flapper dresses and cutting their hair differently. It was the Jazz Age. And of course, Prohibition would come along in a little while. But there was this sense that this is all behind us. We want to look forward. That's the kind of positive aspect of the change in the society. There was also a tremendous downside to it. People were really afraid of the world out there. They still didn't understand where the flu came from. They knew that the war came from Europe. They didn't want anything to do with Europe anymore. So America went into a very, very heavily isolationist mood. Some of the worst and most harsh immigration laws in American history were passed in the 1920s, again, to keep out the dirty, dangerous, diseased foreigners. And in this case, it was largely Eastern Europeans and Italians who were being targeted by the immigration laws, as well as Asians. So that is the downside of it. Is it also a tremendous period of growth of, in addition to the isolationism, the anti-immigrant fervor translated into the growth of the Ku Klux Klan, which is not only racist in its history, but also opposed Jews and Catholics. So this idea of the a white Protestant America came to the fore again. So it was a very complicated time in America in some ways, but there's no question that nobody wanted to talk about it, write about it. There are very few novels or stories or plays or poems or songs written about the Spanish flu. You think about other natural disasters or tragedies, medical tragedies or anything else in American life, and it produces literature. There's essentially one short story by Catherine Ann Porter called Pale Horse, Pale Rider that describes the situation in America during the influenza. But beyond that, very little poetry, drama. There's no great play of the Spanish flu. There were no movies. We think of the literature that's been produced out of HIV and AIDS, for instance, a completely different sense of this. It's not really until 1976 when a researcher wonders why the life expectancy in the United States went down in 1919. He knew that the war deaths didn't explain it. And so we went back and started to do research through insurance company records and saw the number of deaths, and it just wasn't recorded anywhere. And that book, which was written in 1976 by a man named Alfred Crosby, really opened eyes to the fact that the most deadly pandemic in American history had been essentially erased from the record books.
So you mentioned some of the social ramifications, and the questions in the chat just went off, and I had also thought about this as well, because you talk about this in your book, The Attitudes Towards Immigrants and Immigration. a lot of folks in the chat connecting it to maybe COVID and coming or originating in China and some of what's happening today. But I wonder if you could speak more about how those attitudes shifted following the pandemic, because that's, it doesn't continue. And what caution do you think this provides for us today as we're living through another pandemic in a country that continues to wrestle with immigration issues?
Right. Well, let me first bring up an important point that I neglected earlier, and it is important because it relates again to what we've gone through and seen, and how we had even an argument about what we were going to call the coronavirus and this pandemic on a political scale. This word Spanish flu is also a result, the phrase Spanish flu, which was used in other parts of the country, of the world as well. It's not just in English, really is a result of the war again. Spain was a neutral nation in World War I. It wasn't a combatant. What did that mean? It meant it did not censor its newspapers. So when Madrid gets hit by an influenza epidemic and talks about a mysterious epidemic, and those reports make their way to England and are picked up by the wire services, mysterious epidemic hits Madrid, it became, in May of 1918, widely known as the Spanish flu. Eventually, some people called it the Spanish lady. I should point out that in Spain, they called it the Naples soldier, not specifically because they were blaming Italy, but that was the name of a popular song at the time. And the song was very catchy. Get it? Catchy song, Naples soldier. In Germany, they called it the Flanders fever. The soldiers did, at least, after the very famous battlefield in World War I. Later, they called it the Bolshevik flu because they were relating it to what was going on in Russia with the revolution there during the war. In Russia, they called it the Chinese flu, in South Africa, it went by two names, either the white's disease or the black's disease. So this notion that we name diseases and give them kind of political names to blame them on somebody is something that was certainly true in 1918, just as it became politicized last year, with some describing it as whatever they were describing it as. I won't repeat it. So this is, an important idea, but it certainly did add to the sense of isolationism, keeping out the other. People didn't understand where this disease came from, but it must have come from somebody else. In fact, during the war itself, it was widely believed and reported that the Germans had done this. There was the suggestion that German U-boats, submarines had poisoned the water, or that German agents had released germs inside of movie theaters. There was also a suggestion, which is a really interesting one, that Bayer aspirin was tainted. Now, aspirin was the wonder drug of the 20th century. It had just been discovered and marketed a few years before, a tremendous boon to humanity. But it was created by a German company, Bayer. Bayer had to take out ads in this country, and I reproduce one in the book, saying Bayer aspirin is made on the banks of the Hudson River by Americans, because again, this is where the propaganda element of a pandemic comes into play, and we've seen this play out as well. The false information, misinformation, sometimes deliberate misinformation, that gets added to the suppression of information and censorship, sometimes by the newspapers themselves, not even the government censorship, but the newspapers not wanting to talk about an epidemic because it's not good for advertising and it's not good for sales. So largely, especially in the early months, this went unreported in a lot of newspapers, plus the fact that the war was on the front page. And that's what people were interested in. That's what they wanted to read about. So even if there were mentions of the flu starting to spread around, it was kind of back on page 16 in the paper, until eventually it becomes too big to ignore.
Yeah, that was actually a question from Sam. Like, how was the censorship handled, and was it true government censorship, or were newspapers just kind of promoting something else instead? Or I guess maybe was it intentional? Or
a lot of it is, I would describe it as boosterism, that we don't want to report this because it's not good for morale, which again relates to the war effort. And that was certainly, the government was, if they weren't censoring the news, they were putting the best face on things. So we're not going to talk about this, plus the fact that they didn't have any, until well into the fall of 1918, nobody was collecting national data of what was going on. And of course, there are newspapers, primarily local newspapers. The radio isn't really widely used yet at this point. Movies are existing, but they're kind of a novelty, and they're certainly not even in the sense of a newsreel type thing. So there was no mass media at the time. In essence, the government response to this is mainly through posters and flyers that would be put up to advise people on the best practices. But so it wasn't so much government saying, telling newspapers not to say this, as the sense of, we don't want to cause panic, we want to keep morale high, and we want people to keep going to work because we need the factories to keep running, and we need the soldiers to keep enlisting and in some cases being drafted, because there was conscription in World War I. So all of those things factor into this, and it's not as if there was a government agency somehow suppressing the news, but there wasn't the government agency explaining what was going on either. So it's a combination of those two things. Good question.
So we are getting close to time, but and I want to touch a little bit on research. But before I get to that question, there were a couple of questions about anything positive to come out of this. Are we where we are today? You mentioned health departments at another time, earlier. Do health departments or the CDC, do they work to learn from this? And like, what is maybe one positive thing that you could see, so we can end on a positive?
No, it's a great question, and two things come to mind. First of all, eventually Congress began to fund more research. It wasn't overnight. It wasn't like Congress said, "Oh, we really better solve this problem," and there were no big pandemic packages put together by Congress. But eventually Congress realized we need to fund and support scientific research. So that did eventually happen. The forerunner of the World Health Organization actually comes into existence after this, and that's a very positive. It was an outgrowth, of course, of the fact that President Wilson at Versailles wanted to promote the League of Nations, the forerunner to the United Nations, and part of that was a shared medical. So that actually began the creation of an international medical response, because people realized this had to be dealt with internationally. The one social thing I think is important to realize, and I mentioned it briefly, women had changed their role in American life during World War I. We generally think of World War II and Rosie the Riveter as the time when women went off to work in the factories, but that really happens in World War I first. And you see pictures of women sitting in factories putting together revolvers, women going to offices to work with the new machine called a typewriter. This is a major transformation in American society that changed women's roles. They had been on the front lines as nursing was opened up to women in a way that it had not been before. Victorian America, women shouldn't deal with, they're too delicate to deal with sickness, and they shouldn't see men naked. So nursing was not a widely available profession for women. The war and the flu changed that because there was such demand. So a lot of women came back from the war experience plus the flu experience and said, we're not going back to that. So I don't think there's any accident that we got suffrage right after World War I and the Spanish influenza. The role of women absolutely changed in the 1920s in America. Of course, it would continue and be a long haul after that, but there was the vote in 1920, of course. So I think that's a very significant idea. This idea that the war had also changed people's view of their own lives. There was a very famous song at the time, how are you going to keep them down on the farm once they've seen gay Paris? This idea that these soldiers have seen the world and they're coming back. That also, and this has less to do with the flu than the war, influenced a lot of Black Americans who had fought. And of course, we went into a tremendous period of lynching after the war in the 20s, partly as a result of the fact that Black men who had fought in the war were not going to come back and accept their place. And that created a lot of, and they were moving back into a very much of a Jim Crow South. And that created a very violent period in American history as well, eventually leading to things like the Tulsa Massacre in 1921. So it was a tremendous time of change on the ground in American society. Part of it, I think, coming from the flu, part of it coming from the war, but you really can't separate these two things out from each other.
Yeah, that's kind of a great segue. So this book and your talk that I saw in the spring really prompted my research at the Brooklyn Public Library, the Brooklyn Collection. And we also have primary source packet. So that's going to be a primary source packet on modern medicine in Brooklyn. And we will do another session. Jen Hoyer, who's here today, we will do another session in March. So you can keep your eyes peeled if you're an educator and you're interested in that. And there's also primary source packets about women in the Navy Yard and civil rights in Brooklyn. So if you're an educator, there are so many connections to be made from this talk.
I just want to quickly mention two other things quickly. Positives. A lot of people got sick, a lot of people died. Two people that I write about who survived are interesting. A 16-year-old boy who goes off to join the Red Cross ambulance service, gets really sick and nearly dies. His name is Walt Disney. So that was one story that I found that fascinated me. And also a young assistant secretary of the Navy who was in Europe, visits the troops, gets sick, comes home on a ship called the Leviathan, and I write about it in the book. He's taken off the ship by ambulance, taken to his mother's house on Fifth Avenue, nearly dies, and his name is Franklin D. Roosevelt. So how would history have changed without Walt Disney and Franklin D. Roosevelt if they had succumbed to the flu? So that's one extraordinary moment that I take from the book. The other thing I want to mention, before the pandemic, when this book first came out, I was visiting a lot of schools, particularly in Queens and elsewhere in the New York City area. And I have continued to do that, to talk about this book in particular. I've continued to do that virtually. And teachers who are interested in trying to arrange a classroom visit, I do welcome that opportunity whenever possible. And I think we're going to post some information linking to my website, don'tknowmuch.com, that explains how to do that.
Yeah, we are. And that gives the perfect segue for me to wrap up and share that info. And I want to say such a huge thank you, Ken. This was really amazing. Thank you, Rachel, for moderating all of this. My colleague has been putting links in the chat for organizing a virtual visit with Ken. That's also on my screen, and we'll share that in follow-up today. So you can absolutely arrange a virtual visit. And to finish things off today, I'm just going to highlight a few upcoming things, and we have info to share also about receiving CTLE credit or being entered in a draw to win a copy of the book. So a few upcoming teacher PDs, if you would like to earn more CTLE credit and learn more about working with primary sources in the classroom. On March 10th, History at Home, place-based learning strategies to explore local history. And then Rachel mentioned that we'll be doing something on modern medicine in Brooklyn on March 16th, diving into the primary source packet on modern medicine in Brooklyn that she worked on putting together. We're also really excited to work with friends at Greenwood Cemetery on a PD on March 18th. So they'll be helping us look at how we can re-examine historic narratives of enslaved Brooklynites by looking at the primary sources, and we'll be looking specifically at the life of Margaret Pine as a way to reflect on the history of enslaved women during Women's History Month. And then at the end of April, you can watch out for info on PD with our friends at Wyckoff House on the legacies of Dutch colonial Brooklyn. Also, if you're a teacher who's working with students on History Day projects, just a quick reminder that registration is now open. You can head over to our website to find out more. And finally, what you've all been waiting for, my colleague's going to put the link to our survey in the chat. Filling out this survey is your ticket to getting CTLE credit today. You can also opt into a draw to receive a copy of Ken's book. We'll be mailing out 2 copies later this week. And we also really appreciate you filling out these surveys because it's an opportunity for us to just get feedback on what you enjoyed, what you'd like more of, and ways we can support all of you. And so that's it for today. Thank you so much for being here. And we'll hang around for a little longer. If anyone has questions, trouble accessing the survey, we're happy to help. But on behalf of the Center for Brooklyn History, I just want to say a huge thank you for attending, and we hope to see you again soon.